I want to get back to our top local story right now. The rollout of the vaccines, the COVID-19 vaccine in Oregon, has been a slow one compared to many other states across the country.
And that's why yesterday the governor set a goal of vaccinating 12,000 Oregonians every day by the end of the next 2 weeks. Fox 12's Drew Reeves joins us now live. Drew, you heard from the Oregon Health Authority today on how it plans to reach that goal.
Yeah, that's right. The Oregon Health Authority says that right now Oregon is 36th in the nation for vaccine distribution and that just 1.2% of the population is vaccinated so far. Now, they say that number is on par with other states, but agree with the governor that it is not good enough and are preparing to ramp that number up. Tens of thousands of healthcare workers and long-term care residents have received their first dose of the COVID-19 vaccine. And the Oregon Health Authority says it's working to get tens of thousands more vaccinated each week. Yesterday, just more than 2,800 people got the vaccine. Governor Kate Brown wants that number to increase by 10,000 a day.
Distributing and administering large numbers of COVID-19 vaccines is different than distributing and administering large doses of influenza vaccines. And here's a couple reasons why. We're rolling out a new vaccine in a pandemic. Scheduling, physical distancing, and the observation period immediately after a vaccine is administered all have an impact.
Despite those challenges, the Oregon Health Authority believes it can reach the governor's goal.
We need a critical mass of Oregonians to get vaccinated to protect ourselves, our families, and our communities and return to our normal way of life.
The Oregon Health Authority says it's working on initiatives like expanding the federal pharmacy program, which will allow retail pharmacies to vaccinate members of the 1A group. They are also working on a pilot program with OHSU to create vaccination sites for the 35,000 home care workers who don't have a central employer, and to get vaccines to healthcare workers who don't work in large hospitals.
So we're teeing up to be able to start delivering to sites that can vaccinate a large number of employees.
We've received complaints from many of you that healthcare workers who don't work at large clinics are being put behind hospital employees who work in departments that never come in contact with COVID-19 patients. The Oregon Health Authority responded to that today.
We're providing some very direct guidance out to vaccinators that we are still in category 1A and that we shouldn't be moving on to people who don't have patient exposure.
Oregon Health Authority does say that 12,000 vaccines daily in just 2 weeks is a lofty goal, but they also say that in order to get the needed number of Oregonians vaccinated, that 12,000 daily vaccine number will have to go up over time. Reporting live in Southeast Portland, Drew Reeves, Fox 12 Oregon.